Mr. Whitty, in 2023, United Health raked in a whopping $22 billion in profits, making you the most profitable healthcare company in the country. In fact, by revenue, United Health is the 11th largest company in the entire world. Now, Mr. Whitty, United Health Group owns the country's largest insurer, the country's largest claims processor, the country's third largest pharmacy benefit manager, a huge pharmacy chain. It is the largest employer of physicians nationwide, or controller, with at least 90,000 physicians, as you just testified. That's about 1 out of every 10 doctors in the country. Is that correct about your size?
So just to thank you, Senator. As far as the physicians are concerned, we employ just under 10,000,
well,
and the
as
rest
I said,
are
I think
affiliated.
you have control over about 90,000.
I would say not control. They choose to work with us.
Okay. Great. Because United Health has bought up every link in the healthcare chain, you are now in a position to jack up prices, squeeze competitors, hide revenues, and pressure doctors to put profits ahead of patients. United Health is a monopoly on steroids. The opportunities for price gouging are everywhere. For example, United Health is the biggest participant in Medicare Advantage, the government program that pays private insurers to administer Medicare benefits. With this web of subsidiaries, United Health is well positioned to rake in more taxpayer money by using a practice called upcoding to make enrollees look sicker. That is, noticing that a patient has a cane and adding a diagnosis of vascular disease to the medical chart, even if there's no clinical basis for the diagnosis and no treatment planned. Mr. Whitty, according to a 2019 investigation by the HHS Inspector General, United Health was far and away the most aggressive abuser of upcoding practices. Do you know how much, according to the Inspector General, United Health cheated taxpayers out of in 2017?
Senator, thank you for the question. I'm not familiar with that particular piece of work.
Yeah, the number is $3.7 billion, and that's in just a single year, and that's from only 2 upcoding practices. You know, that was 5 years ago. Now, as we speak, is United Health under investigation from the DOJ for, among other things, your billing practices?
Senator, thank you for your question. We have a long-standing practice of not commenting on matters such as that or things like mergers and acquisitions.
Well, I understand why you might not want to comment on it. Public reporting from the Wall Street Journal confirms that it is, although your company has not disclosed this investigation. In fact, yesterday I sent the SEC a letter raising concerns about over $100 million in stock sales that United Health executives made in the days and weeks before the investigation was revealed by the press. And I'd like to make that part of the hearing record if I can, Mr. Chairman.
Objection, sword.
Okay, so United Health is huge, and it boosts its multi-billion-dollar profits with, among other things, illegal billing tactics. And that takes me to the data breach. After the largest cyber attack on the healthcare industry in American history, quote, put hundreds of thousands of healthcare providers at risk of collapse, United Health is now using the crisis to expand its monopoly even further. For example, in Oregon, United Health tried to purchase a local physician practice, but faced enormous public opposition. After the data breach that we're talking about today, these doctors couldn't get reimbursed for their services, which pushes them to the financial breach. So what did United Health do? They filed an emergency petition with regulators to allow them to acquire the doctor's practice on an expedited basis. Mr. Whitty, will this acquisition make United Health even bigger?
Senator, thank you for your question. I'd just like to also put on the record that we, as an organization...
I had a very simple question. Will it make United Health, this giant, this 11th largest company in the entire world, even bigger?
as new organizations join us, the organization, I hope, becomes better as new physicians, for example, join.
The question is not better. We've already talked about your business practices. The question is bigger. Will it make United Health bigger?
As we grow, we become larger, yeah.
Yeah, okay. So, United Health is using its own data breach to snap up doctors' practices that have been driven to the edge of bankruptcy by that same data breach. It's no wonder that United Health told its shareholders that this data breach would have, quote, no material impact on the company's finances. United Health will stop at nothing to grow bigger, bigger, and bigger as we speak. United Health is trying to pick the bones of Stewart HealthCare in my home state of Massachusetts, which was ruined by private equity and corporate greed. It is time for regulators to say no to these efforts to get bigger and to suck even more health dollars away from patients and providers who need it. For the sake of our patients, our doctors and nurses, and the American taxpayer, it is time to break up the United Health.
Let's make this real with an example of a story. Tell us the story of Sherelle Menard and her son Benji, diagnosed when he was 3 years old with autism.
That's right. So over the past couple of months, I've been trying to understand, what are the real human stories behind these documents? It can look like jargon, very dry on the page, but then when you speak to families, you really realize how this impacts them. I've spent a number of, over the past few months, spent some time with Sherelle Menard and her son Benji. He's 10 years old. He's severely affected by autism. He only speaks a few dozen words. They're based in Lafayette, Louisiana, here in Louisiana where I'm based. And, what has happened is that Benji has had increased behavioral challenges over the past year. His clinical team has decided that they want to increase the number of hours of his therapy. So they went to his insurer, which is United HealthCare by way of Medicaid, and they asked to increase the number of hours of coverage that he is in therapy. But they were denied. And essentially what the company said was that Benji had been in this specific therapy for too long, and they did not believe that he was going to make enough progress to essentially be able to leave this therapy. Experts, we showed the denial to many experts and advocates who said this was outrageous, that, this type of therapy can be used for the maintenance of, or prevention of deterioration, or just to help kids maintain the progress that they've already had. And so Sherelle Menard now has to go to an official administrative law review in order to try to get this denial overturned. She's doing that next month in January.
And how might United HealthCare's strategy be violating a federal law?
Yeah, so most people don't realize this, but there's actually a federal law that protects mental and behavioral health benefits. It's called the Mental Health Parity Act. It was passed in 2008. And essentially what it means is that insurance companies cannot limit your access to mental health care. They essentially have to provide similar access to physical health care as they do for mental health care. And so if this company is using similar strategies to limit physical health care, perhaps it's kosher. But, the experts and the advocates that we've spoken to have said that this strategy is legally questionable. On top of that, it appears that the company is actually targeting Medicaid plans, so the most vulnerable and the poorest families amongst us with this strategy. And so this strategy may actually, according to the advocates we've spoken with, it might violate Medicaid laws as well, which require prompt access to medically necessary care for children.
Look more at Luigi Mangione, the 26-year-old accused of killing United HealthCare CEO Brian Thompson as he walked to a shareholders conference in New York City on December 4th. Mangione remains in custody in Pennsylvania as he fights extradition to New York. He's hired the prominent lawyer Karen Friedman Agnifilo to represent him. She is the former second in command of the Manhattan District Attorney's Office. A defense fund for Luigi Mangione has already raised over $100,000 in the latest sign that he's become a folk hero to some. On Sunday, Senator Bernie Sanders appeared on Meet the Press and talked about why there is so much anger directed at the health insurance industry.
What you have seen rising up is people's anger at a health insurance industry which denies people the health care that they desperately need while they make billions and billions of dollars in profit. So killing anybody, shooting somebody in the back who's the father of two, is outrageous. It is unacceptable. Nobody should applaud it. I know Senator Warren did not. But I think what we need to ask ourselves when we talk about health care is why we are the only major country on earth not to guarantee health care to all people, why we have a life expectancy which is significantly lower than in other countries, why working class people die 5 to 10 years shorter than the people on top.